Joining me now are three people who many have turned to for their expertise during this pandemic. Dr. Michael Osterholm, who's becoming a familiar face. He's director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Dr. Joni Khaldoun, she's the chief medical executive for Michigan's Department of Health. And Dr. Wayne Frederick, president of Howard University. And a reminder, he is one of the few university presidents who's also an MD. Welcome to you all. Dr. Osterholm, let me start with you. Is there any way we avoid what some people thought was alarmist a few weeks ago when Dr. Fauci said he was worried about 100,000 cases a day? Is it inevitable at this point that that's where we're headed in a couple of weeks?
Well, to put it into perspective, again, we look at where we've been. We have probably infected between 7 and 8% of the U.S. population to date. That's it. For all the pain, suffering, death, economic disruption, that's it. As we've talked about on this very show, this virus won't slow down even, let alone stop transmission until we get to 50 or 60%. To put that into some kind of perspective, Chuck, if we had 65,000 to 70,000 cases a day for the next 365 days, it would just begin to get us to that level. So we have a lot of human wood to burn in this coronavirus forest fire. And, we may see ups and downs in communities where people do take more concern for a moment because of the severe problems. But I think it's not only likely we're going to see much more than 100,000, but I don't think people understand if we don't change our ways, we are in for the next year of those very kinds of numbers.
Dr. Khaldoun, I know that the scientific and medical advice is essentially we've got to do a reset, maybe go back to the shutdown and maybe do it right a little bit better than we did the last time. Can you imagine the political will in Michigan to do that again?
I'm very proud of the people in Michigan. I'm proud of Governor Whitmer. She has from day one listened to the data, listened to the science. But I'm very concerned. I'm very concerned that people are making things, very simple things like mask wearing, political. I'm concerned that people are gathering in these large groups. Many people across the country heard about a bar where we've seen over 150 cases of COVID-19 associated with people gathering. So I'm very concerned, but I'm also confident that Michiganders can do the right thing because we did it before. We saw over 150 deaths a day in Michigan back in March and April. We brought that curve down. So I'm confident we can do that again.
You see that it's coming back up. Do you have a sense of why? Do you think it is, Dr. Khaldoun, do you think it is simply younger folks sort of laxing on the requirements, or is there something else going on?
So, like I said, we saw our cases come down significantly after a surge in March and April. What we're seeing now is as we've started slowly reopening the economy, we're seeing all kinds of cases of people gathering, churches, bars, people having these house parties. We're seeing some outbreaks associated with some of our migrant farm workers as well. So there's multiple reasons why we're seeing an uptick. What I can say is that the demographic has also changed. Before June, most of the cases we were seeing were in people over the age of 50. And now the top age group for new cases is in the 20 to 29 age group. So that's something we're concerned about.
Dr. Frederick, you and I have talked quite a bit since the start of this pandemic. And early on, you were very optimistic about Howard University developing its own test, and you were going to be able to almost create a bubble on your campus. I know you've made an announcement of sort of a hybrid situation. Are you as confident that you're going to have the testing capabilities that you thought you might have 3 or 4 months ago?
Yeah, I am. Later this week, we hope to sign an MOU with a company that I will leave unnamed for now. But they are going to help us stand up a CLIA lab at Howard University, where we'll be able to do our testing internally. That will allow for us to have a very good turnaround time. However, with respect to a bubble, we have to be realistic that we're bringing students from 46 states and 71 countries. Obviously, there are travel bans in place, and U.S. embassies are not necessarily issuing visas, so international students may have some difficulty returning. But bringing people from hotspots is going to be a challenge. So we also are looking at testing, having students tested before they come and self-quarantine prior to their trips as well, and obviously making tests available on campus. So you're right. I'm still optimistic about it, but I do recognize that there are challenges, especially with what's taking place in the country as a whole.
Dr. Osterholm, this debate about reopening schools, let's go data-driven here. What is the best data to follow on these decision makings, whether you're opening a campus like Dr. Frederick or an elementary school?
Well, I can tell you right now that schools across this country do not have the resources to open this fall with the personnel, the protection, et cetera, that they need. We have surely sent money to the school districts from the federal government, but it's far, far too little. It's inadequate, and it's not being not arriving in time. And so I think that we're going to have some real challenges. There are legitimate concerns in any community right now where you have a hot spot. How can you even begin to think about physically opening schools? Distance learning surely can be something you can consider. Still, we have concerns about the protection of teachers. We have to understand that that is in itself still a really hot issue. We do know that students transmit more than we once thought that they did. And so we have to address that. Right. At the same time, we know that we have to educate our kids. This is really critical, particularly that younger age group, K through 8. Distance learning just does not work. So I think we have to, first of all, drive down the decision making to the local school district level. They're the experts. They know what they can do. Those teachers want to go to work. Those school districts want to have school. And we just have to make sure we get them the resources to do that and know that there isn't going to be a simple answer. Anybody who has the right answer on this topic doesn't have an answer. Yeah. The wrong answers are driving it down from the national level, saying this is what you must do, and not providing the resources that these school districts need. They need it now desperately.
Dr. Frederick, where are you getting the money for all of this?
Well, what we've been doing at Howard is we've been supported, obviously, with the CARES Act funding. We've also really had some very, very tight management of our overall budget over the course of the past 3 months as well. This will put us in a financial bind because of how many low-income students we bring to Howard. But it's also important that we recognize that Howard in many ways represents a safe place for them, and that investment is one that's immeasurable. And so it is a sacrifice that we all have to make, and it will be difficult.
Doctors Osterholm, Khaldun, and Frederick, really appreciate you sharing your expertise with us this morning. Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.